I will be reviewing Chapter 16, Adolescent Pregnancy and Parenthood. I would recommend taking out a paper and pencil to take some notes. Prevalence, I will talk about the prevalence in the US of teen pregnancy and the outcomes of teen parents and the associations of mental health with teen pregnancy. And lastly, I will mention prevention and intervention recommendations according to the book. Prevalence and social cost. So in the US, about 1/3 of teenage girls get pregnant before the age of 20. 1/5 of American girls have had sexual intercourse. 85% of teens are not using birth control. About 700,000 teenage girls are pregnant every year, and over 400,000 of them give birth. Social cost. Every year, the government spends about $9.1 billion on childbearing for mothers under 20. Other costs, according to the textbook, are cost of healthcare, welfare, prison cost of male offspring, and taxes. Outcomes for teen mothers and fathers. So some negative outcomes are poor mental health, poor physical health, decline in academic functioning, and financial situations. Pregnancy can be overwhelming in itself, but for teens, it can be more overwhelming because of stressors inherited to adolescence. It can also affect mental and physical health. An apparent cognitive decline will happen to teen mothers, mostly known as pregnancy brain. Those who do not carry the pregnancy to term may have additional concerns. It can affect their mental health and may cause feelings of guilt or loss. Giving up a child for adoption may also cause lasting effects for an adolescent mom. Risk factors for teen mothers. They are emotional distress, high school dropouts, and low earning potentials. This is made worse with each sequential birth during youth. Also, there's an increased likelihood of having a psychological disorder. Rates of major depression, anxiety disorder, suicidal ideation, and suicide attempts are higher than compared to a mother who has a child between age 21 and 25. So risk factors for teen fathers are higher rates of high school dropout, lower earning potential, and a burden to support a child. And these are so burden to support a child is a risk factor because some teenage boys will drop out of school to get a job to make sure they're providing for their child, and or they will have less quality work, less interest in school because they have this new big responsibility that they have to face. Teen pregnancy can be predicted by a combination of factors, some of which are both associated with poverty, poor academic performance, prior sexual experience, and family structure. So research has shown that both male and female teens who engage in aggressive and disruptive school behavior can also be associated with the increased likelihood to be involved in teen pregnancy. So these mental health issues will can be a risk factor to teens getting pregnant. So emotional distress, anxiety, depression, conduct problems, negative early childhood experiences, and abuse. Also, prior pregnancies. So about 20% of the teen pregnancies are from girls who have already given birth. And that's something that we shouldn't take lightly. If a teen is already pregnant, there needs to be an intervention for that student because they're likely to have another baby within their teenage years. So family background, this was very interesting in the textbook. They mentioned having a dominant older sister of a single can be a risk factor of getting pregnant, a single parent household, and drugs and alcohol use. And also, lastly, the textbook mentions perspective on teen pregnancy. Teens' perspective affects the likelihood of teen pregnancy. And the book does mention how teen pregnancy is not looked as a negative situation as much as it used to. So the perspective of teen pregnancy is changing according to the textbook. So effects of teens' offspring. So father involvement, increased risk of mental health, and other factors. So for father involvement, there's a high risk of inconsistent levels of involvement with child, and involvement decreases over time. Children with low father involvement are more likely to demonstrate emotional and behavioral problems, an increased risk of drug use, criminal behavior, and incarceration. So increased risk of mental health, systematic complaints, anxiety, attention problems, and aggression. And there's some educational effects, so difficulty with math and reading, and they're more likely to receive special education services. They are also likely to have poor academic performance, school failure, and behavior problems, and also they can become teen parents themselves. So proactive factors. The following factors increase the likelihood of a child abstaining from sexual activity. So as future educators, I think this is very important when interacting and having supporting a teenage student that is having, that is showing risk factors associated with teen pregnancy. So greater academic success, higher aspirations about their future, and strong connections to home, school, and community. Factors that influence teens to have or not to have sexual intercourse. So individual biological factors, personal and family values, connections to adult and organizations that discourage sex, unprotected sex, or early childhood bearing. So some interventions mentioned in the book are future-oriented, positive social concerns, and father involvement. So for future-oriented, it's just encouraging students to develop life goals. So if pregnancy will be viewed as a risk to their plan in the future. Positive social connections, enrollment in community-based programs, strong familial connections, community involvement, and service learning, after-school programs. And father involvement of offspring is actually a big factor. If fathers are involved in the teenage life, there's a less likelihood to teen pregnancy, and that has been proven. That has been shown in research. So preventing pregnancy. So in the textbook, they talk about curriculum-based education and encouraging students to abstain from sex or use contraception. The second recommendation they gave was service learning, community service activities that community service activities and ideal, including time designated for processing students' reactions to these activities. The third is youth development, promoting consideration for future aspirations in a broad range of activities, and for parent programs involving both adolescents and their parents. So reducing negative outcomes for teen mothers and offspring. Parental care and reproductive health care system. Providing quality child care and promoting preventative health care for child. And lastly, offering parenting and life skill trainings and supportive services. So the role of school mental health counselors. This was a section that was very prominent in the textbook, and they talk about how counselors or school psychologists should give emotional support, provide student with resource info, and supporting good parenting. So providing counseling for those students who appear to be at a risk or who seek support. Early interventions of the student who are in high risk for teen pregnancy. Counselors should offer their services, especially to those who are dealing with grief or loss if they didn't have the pregnancy to term. And supporting good parenting when working with teen parents. Talk about, what are some strategies of becoming a good parent and how to learn about the development of a child. And educators that are working closely with teen pregnancies or teens that are pregnant should consider the development stage and progression of both teen parents, the multi-generational family dynamics, significance, and fragility of the teen-parent relationship to all of those that are involved. And lastly, advocate. As educators, we should advocate for those expecting students and teen parents. Some ways that the textbook recommends that we advocate are inform students of their educational rights during this time, being aware of their rights to be excused. So letting the teen parents know that they have rights to have more excused absences due to doctor's appointments for the pregnancy and for when the teen mother gives birth, she can also have more excused absences for recovery. And then encourage students to stay on track for completing their schooling. Support teen fathers who want to be involved in child's life. And some ways of doing that are informing him of his parental rights of the child. I really enjoyed reading this chapter. I feel like there's a lot to be learned and considered as future educators that was said in this chapter. Thank you guys for listening, and I hope you guys have a good one.